The City Commission, acting in its capacity as the Community Redevelopment Agency, has moved one step closer to allowing a developer to build a new health and wellness complex downtown. In what CRA Director John Ward stressed was the beginning of a public process, not the end, the CRA decided to begin to sit down with one group to see if a deal can be reached. The complex would be constructed on the so-called tent site, a nearly 2.5-acre parcel of land at Okeechobee and Dixie Highway, which is now a parking lot. During the CRA meeting, two developers who want to build on that spot made their pitches to the CRA. First, Michael McCluskey proposed two high-rises, 13 and 15 stories tall, which would house medical, physical therapy, and substance abuse facilities, as well as a high-end grocery store.
All of the medical providers mentioned are nonprofit. However, it is anticipated that the West Palm Beach Health and Wellness Center will provide millions of dollars to West Palm Beach's annual tax revenues. To complement the healthcare institutions, the project includes a fresh market, a concept that has been greatly needed in downtown for years.
Developer Navarro Lowry proposed a 10-story medical office building with retail space and a parking lot.
What we envision is an economic development hub anchored by medical services facilities, a health park, if you will. The facility would be positioned to attract physician groups, including primary care and a host of specialists, clinical resources such as diagnostic imaging suites, lab testing sites, hospitals looking to expand their ambulatory care and outpatient services footprint in the West Palm Beach.
In a surprise twist during public comments, developer Al Adelson told the CRA that he'd been in talks with the prestigious Cleveland Clinic about building a facility at the site. Adelson told city leaders that instead of accepting the proposals they'd been considering, they should make a deal with him.
We will write a check tomorrow morning for fair market value of that site. I don't need to borrow the money and get leases signed, and we'll buy the site right now at fair market value of your appraisal.
In the commission chambers, packed with local healthcare professionals, many of them from nearby Good Sam and St. Mary's hospitals, there was fear that any new medical facility would take patients away from them.
I don't think Miami Children's would enjoy having Johns Hopkins Children's Hospital or Children's Hospital Philadelphia being placed in their city. Okay, I think that would be a conflict of interest, and I believe the same is true here.
Mayor Moyo, who heads the CRA but does not vote, was in favor of opening up the bidding process again before any decision was made.
My bottom line is, we can go ahead and negotiate with these folks, but I know that there are other people who would like to present a proposal as well.
Commissioners Moffitt and James expressed concerns as well.
What our hospitals offer is a level of service that you won't offer. You're going to offer the highest of the high. You're going to take away the money-making operations that these hospitals currently use.
I, for one, want to make sure that we get as close to fair market value for that jewel of a parcel as possible, and that's why I insisted when I met with Mr. Ward that we go out for an appraisal, because I want it to be clear as to what the value of that property is.
But there was also support for moving forward from Commissioners Mitchell, Materio, and Robinson.
I mean, Mount Sinai, come on. People, that's a phenomenal healthcare institution. Phenomenal. Phenomenal. These are great components that any city, any community would fight and claw to get.
In the end, the CRA voted 3-2 to accept McCluskey's proposal and to begin talks to see if a deal can be reached with him. But he still has some hurdles ahead. The land must be appraised, and after that, McCluskey will have 90 days to make an offer, which the CRA can either accept or decline. This is Elliot Cohen reporting for TV 18.